good afternoon, everyone. Thank you for spending your afternoon lunchtime here to hear our very first State of the School address for the Herbert Wertheim School of Public Health and Human Longevity Science. It is so good to see you all. I see faces that I haven't seen in a while, and that makes me very happy. Thank you for coming to hear what's going on in the school. It only makes sense, if one's giving a State of the School address to really pause for a minute and look around and think about public health in general. And, this morning, I don't know how many of you get a news feed into your smartphones, but my news feed into my smartphone made me really mindful of just how important public health training and the work of public health professionals are. For example, we learned this morning that the far-reaching effects of gun violence continue to permeate through our society. Right? I just want to take a moment now to acknowledge the victims, the family, the friends, the community impacted by what happened yesterday in Texas. We also saw quite a bit of conversation in the media this morning around infant formula shortage, right? A public health nutrition issue. We are continuing to see persistent SARS-CoV-2 infection. We also have war at play, and we know war has devastating effects on forced migration as well as public health outcomes. And if you think about also what's happening in the Supreme Court of the United States, we know that that is also a very big public health issue. And so now more than ever, the world needs change in public health, needs training in public health, needs research and partnerships in public health. So as for our school, where are we? Well, I think about us as the kind of place where we honor an over 60-year history and strengths within public health here at UC San Diego. And we as a community, we have decided to boldly blaze a trail towards a thriving 21st century school of public health. I think overall, our school can be characterized as one that is growing during a difficult time globally. With our growth, we've had some growing pains, and we'll talk about that in a little while, but we've also demonstrated a great deal of resilience. And we're also a school where we're mindful of the responsibility that we have to be good stewards of public resources. We are a public institution that while we're engaging in our public health efforts, we're also mindful of the impact that we have on the health of the region of San Diego and beyond throughout our state. And of course, those things have implications for what happens nationally as well as globally. Within our environment, our culture, we are carrying a heavy load. We've been through a pandemic. We've been through strategic planning. We are continuing to do the work that we do day in and day out. And we have quite a bit going on. And I'm a little bit concerned about, our burnout potential and wanting us to live into that resilience that I see as our potential. We also have the challenge of recruitment and retention within a new school. And we want to create a culture that minimizes and harassment, mistreatment, aggression, and really promotes wellness and safety. And so if you look at our values and our mission statement that we put together, we want to ensure that the infrastructure of the school promotes all of the precursors to those values of respect and compassion. And that way we can fulfill our mission accordingly. I also want to say that our school's education programs, they are robust, as you will see over the next hour. We are well poised to meet 21st century public health problems. We have a number of faculty running 6-degree programs. We have over 50 research groups, and we're trying to expand what we do. We have had planned leadership transitions within our teaching programs, and some of our early career faculty are now assuming leadership, and that's really nice to see within the school. With regards to research, the school is the steward for a respectable amount of research grant money that supports our outstanding public health faculty and staff. And it displays really clear and consistent strengths in key areas of public health disciplines. And we're working on chronic diseases, including obesity, hypertension, heart diseases, and cancer, and looking at this across the life spectrum and focusing on older adults as well. And then, of course, we're building in strategic priority areas. We were able to be nimble during COVID. We were that school that reached out to our county health department, that reached out to others across the state, formed with a number of you who have spaces I see on the call, thank you, a part of the Return to Learn program that was critical during COVID, working on contact tracing and allowing the kind of input that requires public health knowledge into what was going on as the campus never one day stopped bringing students back in for learning. And we were nimble. Many of you pivoted the research that you do in order to accommodate what was going on during the pandemic, serving as advisors for Representative Mike Levin, for example, and being there when partners from our community reached out. So thank you for that. And then with regards to the business of the school, our school's fiscally healthy. You'll see that we're living within our resources. We have a minimally positive budget. However, our future is bright because as the school grows, our resources will grow thanks to the endowment bequeathed to us by Dr. Herbert and Nicole Wertheim. So I, at this point, will share my screen and I will talk through some of the things that are going on in each of the areas of our mission, and then we'll have some time for questions and answers at the end. All right, so for those of you just joining us, welcome to our State of the School Address for 2022. I want to start with reflecting on our mission of the school. So with a commitment to equity and justice and rooted in a culture of respect, the Herbert Wertheim School of Public Health and Human Longevity Science will lead in innovations to improve public health locally and globally. And we're largely focused on three key areas. One is regards to our training. So we want to cultivate new generations of diverse public health professionals. Then with regards to our research and community academic activities, we want to advance scientific discovery, dissemination, as well as implementation. And we do that by collaborating with diverse partners to develop community-led solutions. So first, I'd like to cover what's happening in the space of education and student affairs. So our educational engine is largely supported by a very strong team. We have 6 different programs, and our program coordinators are key to our being able to succeed in this space. So I just wanted to take this time to recognize the staff that you see on the screen here and say thank you for all that you do to support our programs. You'll notice that we're training from undergraduates all the way through to residency programs. And so we really have a chance to impact the lives of professionals who are training in public health at every stage of their development. With regards to our Bachelor of Science in Public Health program, we now have over 600 students engaged and enrolled in that program. When we look at really the impact overall, though, of this BSPH, we are touching the lives of over 1,500 students every year who take our classes and who will use public health perhaps in another space and with another discipline. And I think we're all better off for that. 1 out of 3 of our graduates have gone on to public health related jobs or internships, and about 1 out of 4 are going on to pursue advanced degrees. And as you can see, I think they're having a great deal of fun in and outside of our classrooms as they engage in this degree program. Another notable event in our BSPH program is that Dr. Dennis Trinidad, who served as the director for this program for 9 years, has transitioned out of the leadership of the program, and Dr. Argentina Servin and Dr. Britta Larson are now the director and co-director, respectively, for the BSPH program. So thank you all for your service. Our Master of Public Health program now has 77 individuals enrolled. And this is no small feat, thanks to the direction of Dr. Michael Pratt, Dr. Sarah McMenamin, and of course, the steering committee that helps to support this program. It has been thriving. The health policy concentration is new over the last year and has also been doing quite well. Our joint doctoral program in public health is a longstanding PhD program that we administer in partnership with San Diego State University. The enrollment in the JDP is 68. We've had some exciting things to announce with regards to the doctoral program. Dr. Bazzi is the new director of the global health track, and we thank Dr. Kimberly Brower for her service in the role prior. And our students are thriving and doing really quite well. Dr. Alec Kalak, soon to be Dr. Alec Kalak, was invited to the White House to serve in the monthly Health Equity Leaders Roundtable series. Alec is both a medical school student as well as in our PhD program. And then we celebrate what's been going on in our MS and PhD programs in biostatistics. This is amongst the newest programs within the schools. The first cohort for the MS came in 2020. The enrollment across those programs is 46, and they graduated the first PhD student in November 2020. That program preceded the MS graduate program. And their doctoral students have been doing really well. Christian Pasquale in 2020, Jasmine Morales in 2021 received really high-level awards and fellowships, the Kostkin and the Seed Fellowship. And the doctoral program in biostatistics will be included for the first time ever in the 2022 U.S. News and World Report rankings. It's a time to celebrate, right? All that's going on in our educational program. And we have now the opportunity to do the very first recognition of graduate ceremony for our school. That will happen on June 10th, 2022. And I invite you all to come and celebrate with our graduates. You'll see that in the BSBH program, we're graduating 167 students. In the MPH program, 27 students. In the joint JDP program, we're graduating 8 students. In the biostatistics MS program, there will be 11 graduates. In the PhD program, 6 graduates. And then we also administer under the leadership of Dr. Todd Gilmer and Dr. Bob Kaplan, the MAS in the leadership of healthcare organizations, and they will graduate 13 students this year. So you see, this is really reason to celebrate. We have quite a bit of activity going on, and our programs are thriving. With regards to our mission, as you heard me articulate it earlier, we want to cultivate new generations of diverse professionals. These numbers give me hope that we are on the right track and we will just be even stronger over time. When you look at our faculty who participate and teach the students of this school, we're 56% female and 12% underrepresented in science. But when you look at our student body, you see that it's quite diverse across most of our programs within the BSBH. We're well over 75% female, and we are at 40% underrepresented students. In the MPH, 80% and 30% underrepresented students. The PhD in public health, 70% female, 30% URM. Within our biostatistics, MS and PhD programs, we have roughly 45% female, and about 8% in the MS program are underrepresented. And then in the MAS, which serves really a great community need, we see that we're doing quite well also, over 50% female and over 45% underrepresented students. So again, we're really living into the mission that we set forward for ourselves. So with regards to this education and student affairs, this is where we are right now. We have 6 degree programs. We have T32 fellowships funded by NIH that our students can take advantage of. Dr. LaCroix runs the fellowship in aging, and that sits within the school. And then the fellowship in cardiovascular disease epidemiology, as well as the fellowship in data sciences, are outside of our school. However, the students of our school are welcomed into those fellowships, and there's quite a good amount of representation there. The general preventive medicine residency that's done jointly with San Diego State University has continued to thrive under the direction of Dr. Linda Hill. And again, we'll be recognizing our first set of graduates. Within our near distant future, we are going to establish a new PhD program, and we're looking forward to beginning the process for accreditation by the Council on Education for Public Health. So again, we're doing quite well with regards to education. How are we doing with regards to our research affairs? Well, we are a robust faculty. You'll see here, we have 92 research staff that support the academics and faculty of the school. There are 75 faculty with primary appointments. You'll see the breakdown for those 75 listed here on the screen. And then we have 28 faculty with secondary appointments. We have 18 MSP physicians. We have 9 project scientists and research scientists. We have 3 with regards to our postdoctoral fellows, 11 of them, and then we have 6 visiting scholars. And I mentioned earlier, there is a bit of diversity within our academic and our research group. I want to take this opportunity to welcome our new faculty. So on the left side of my screen, you'll see the faculty who have come into the school with primary appointments. Here we have Dr. Angela Bazzi, we have Dr. Chadwick Campbell, we have Dr. Mara Lee Harrell, and Dr. Corey Peak Asa. And so you will have a chance over the next few months to meet these individuals. And hopefully as we get to our new normal and our COVID protocols are adjusted, we'll be able to meet them outside of the Zoom room setting. Our secondary appointments include Dr. Crystal Sine, who's now the Chief Administrative Officer for Health Equity, Diversity, and Inclusion in the hospital. We have Dr. Sid Leibel, who's an Assistant Clinical Professor in Pediatrics, and Winta Metzen, who's an Assistant Professor of Surgery. And I would not be overreaching when I say that the secondary appointed faculty during their recruitment into other parts of our health sciences inquired about this new School of Public Health, wanted to hear about what do we have happening, wanted to be a part of our community, and their recruitment was supplemented and really enhanced by our existence as a school. And we'll see that continuing to happen over time. Now, this portion of the state of the school was really the hardest one to try and figure out highlights for. But I've decided to focus on these 4 areas with regards to our research highlights. As you know, we are a thriving research enterprise. Those over 50 research programs bring in over $125 million in direct costs from our various funders nationally, as well as contracts that we have with various groups. And it's difficult to say, what to highlight. However, I thought these 4 really spoke to the spirit of what we're doing here in the school. So the first thing that I want to highlight is the new collaboration that we've put together with the San Diego Center for AIDS Research. And so a number of our faculty have been engaged with CFAR here for quite some time. However, it was really promising and nice to see us come together and think about putting together a development grant where both the school as well as CFAR put funds together in order to promote research that's going to happen in the space of AIDS research that overlaps with our strategic priority areas for the school. I also want to point out the 2022 Public Health Research Day that happened. And after a 2-year pandemic-induced hiatus, it came back last week. The forum had a symposium by Dr. Fauna Foreman, who's a professor of political science. And after the Zoom forum or symposium, there was a poster session held out in the MET atrium. There were 44 posters from our undergraduates, our graduate students, our postdoctoral fellows, as well as the preventive medicine residents. And first and second place prizes were awarded in each of the categories. And for the first time, one student received the ACTRI Life Course in Vulnerable Populations Research Award. So again, I want to say a special thank you to the organizing committee and to all of the volunteers that made that happen, in spite of the fact that we're not yet fully back into 100% out of remote activities. And then I also wanted to highlight a recent grant that was made to UC San Diego from USAID to improve global health equity. And this is an effort that's being led by Holly Shakia, who's primarily appointed in the school, and colleagues over in the Department of Medicine subsection for global public health. And it's really a wonderful opportunity to think both on the international level as well as a multi-institutional level about how we create agency within girls and women across the world in order to promote the overall health of populations across the globe. It's the largest ever award given to UC San Diego by USAID. And it's a 61-year-old program that really addresses poverty and encourages sustained economic and social development throughout the world. So congratulations, Holly, on that work. And thank you for giving us something to celebrate that has such tremendous public health impact. I also want to highlight the efforts of Dr. Rebecca Fielding Miller, who's an assistant professor in our school, with regards to a San Diego County Health Department contract that she and her team received to support COVID-19 surveillance. So Becca is working with a number of collaborators here on the campus, and Dr. Rob Knight's one of them. This is a multi-million-dollar contract from the county and HRSA in order to do contact tracing efforts in high-burden elementary schools and childcare settings. She really embraced the potential for wastewater to be used as surveillance, and also looked at environmental surfaces and what their contributions to disease transmission throughout the pandemic. So their efforts in intensive COVID-19 surveillance have allowed our neighborhood schools to remain open at a time when many school districts were quarantining classrooms or even their entire schools. So again, wonderful work. It really says, why schools of public health need to be in focus, need to be in place, and why our new School of Public Health is going to make such a vast contribution to our local community and beyond. In addition to the thriving community that we have, we'd like to grow our faculty and academics, and we have some active recruitments. In public health, a general non-FTE professor search. We're also looking to recruit in climate change and planetary health, in epidemiology and health equity. There's an advancing faculty diversity cluster hire that is ongoing. There's also the potential for the efforts of the Office of Faculty Affairs within Health Sciences, this proposal being led by Joanne Trejo, and our very own Elena Martinez is involved there as well, to expand what we're doing with regards to diversity cluster hires. And so our fingers are crossed, and we are hoping with you that the first award will be awarded. I would like to say congratulations on the tremendous work having scored within the teens during that review process. We're also doing a partner recruitment with the Design Lab and recruiting for lecturers as well as individuals who work in geosciences, and we have a chancellor's joint hire ongoing in that space. Now, there's one thing to talk about the work of the place, but it's really important, I think, to think about the people of the place and the experience that they have within the place. And how do we find joy in the work, and how do we remain, again, resilient and flexible? And that those efforts are being thought through and implemented by our faculty as well as our associate and assistant deans who work in the space of faculty affairs. So I want to highlight here a faculty affairs work group recommendation that came forward in summer of 2021. And thank you to Aladdin Shadiab for chairing this work group, for us to create mentoring pods, a new structure within the school that combines early career, mid-career, and senior faculty and academics for mentoring and career counseling. And that recommendation has been put into the implementation phase by Doctors Hong and Trinidad, who are working with Dr. Bloss and Gilmer to think about how do we construct these pods. A survey was sent out to our early career academics, including those at Step 1 associate, as well as the assistant professors, to really get their feedback in how we build this so that it can be as useful and appropriate as possible. So in sum, with regards to our research initiatives, we have 4 centers of excellence and 50 plus funded research groups that allow us to do the kind of work that you've heard described over the last few minutes. And we're going to be moving toward really trying to build more multidisciplinary research projects focused on our strategic growth areas. And so creating an infrastructure that allows us to do that with as much ease as possible. We also want to establish community and institutional councils of campus and external partners, because if we're going to make the leap from doing the research in the university setting to actually the implementation and impact that we'd like to have in the community, we need to have community at the table every step of the way. So I think as we're thinking about the mission of advancing scientific discovery, dissemination, and implementation, again, we're doing quite well. And I look forward to seeing us develop this even more in the future. Now, I just want to talk a little bit about the business of the school, the business affairs. So with regards to our finances, essentially the school is in its very early days, as you know, and we have constraints on our resources. So we've been careful to operate within those resources. We have, as I mentioned, a positive annual operating budget. As we grow as a school, our resources are going to grow, and we will be able to, over time, really increase the support and initiatives of the school. As your dean, I continue to pursue multiple sources of funds for our school that fall beyond what the scope of faculty work is, including working closely with our development and advancement office, and really trying to find opportunities for the school that are complementary to the things that we've done and we have a lot of strength in, as well as to our strategic growth areas. As for now, our primary sources of income include the indirects that we get from grants and service agreements, as well as from recharges that are within the school. There's a core tax that is levied against those units. There's also the contribution that's made by faculty who hold state full-time equivalents, or FTEs, and that varies by career phase. In the early career, that tax is waived, and then across the associate and assistant and full professor roles, we contribute to the school's general resources. And then there's negotiated support for the school that, as your dean, I make with the Vice Chancellor for Health Sciences, as well as the Chancellor. We have had contributions. For example, people will pay IDC on monies that come into the school in order, again, to support the base of the school. We have our endowments, the Wertheim Family Endowment, as well as the John and Sally Hood Family Endowment. And the Wertheim gift, as many of you may remember, is 6 separate endowments that over time increases to a principal of $25 million. And so we're going to, over the next 9 years, be really growing the payout from that endowment. The current principal value and the annual payout is at about $7.7 million, with a payout of $300,000. And our general use funds includes about 100,000 of that. The MPH and the MS in biostatistics, after their fiscal startup phase is completed, then they will begin also to contribute to the income sources of the school, but that is not yet currently the case. So what do we do with the finances once the money comes in? Well, we use it to support the activities and the people of the school. We pay for faculty who don't have FTE, 3% salary support. This is beyond what's generally done in health sciences, but we recognize that this line of faculty appointment in our school, we'd like to have some support for the faculty being associated with that. They are as included in our community as faculty who have FTE support. And so we are constantly working on ways to figure out how to add more support there. We use it for administration, for faculty, and we also have general operating costs that we cover. We cover our pension expenses, their taxes from the University of California Office of the President that we pay. Many of you know about our shared services across health sciences, the Academic Resource Corps, the Human Resources Corps, the Information Technology Corps, Research Services Corps. And then we cover school events and strategic initiatives. So in sum, our finances are healthy, and I think we've been good stewards of the resources of the school. Now, strategy is really important, and the financial bits of the school are really important. But I also want to spend some time talking about our climate and our culture within the school. And so I want to focus in this section of the address on our educational efforts around justice, equity, diversity, and inclusion, as well as what we're doing in the space of community engagement. So our school community has been engaged in several efforts around JEDI. We've done school-wide gatherings to really help us think about how do we communicate well and dialogue around issues related to current events within the world, as well as our local area. We formed a compassionate action circle. Thank you to our JEDI, Sonia Jain, who is in the leadership of this compassionate action circle and has already outlined for next year what those activities will be in the recurring meeting of the circle. This was an idea that was actually born out of the racial resilience training that we did with Doctors Carter and Shane when we started the school. And this idea came up in one of the first racial resilience groups, and I can still remember, Dr. LaCroix saying, "Wouldn't it be amazing?" Our team, out of our small group, thought if we could apply this compassionate action anti-racism circle to our school's activities routinely, and so it's really exciting to see that come to bear. We've had several guest speakers come in to support our JEDI efforts. We had Isabel Wilkerson join us. We had Professor Loretta Ross join us, Mr. Kent Lee, Simeon Mann, who's here on the campus, really to, again, form conversations with us and help us think through and engage in a scholarly way as well as a human way around issues related to JEDI. We've also been thinking beyond ourselves and really thinking about how to foster relationships with our community. And our JEDI efforts are actually really important as we think about moving into the greater community, because we know that to do public health work sustainably requires building trust and establishing relationships that are longstanding. And what we learn about how to manage through issues with each other in the JEDI space really does serve us well in our community relationships. And so thank you to those who continue to support us in this space as we build our internal campus partners. You've heard about what we've done with CFAR, some of what we've done with CFAR, what we're doing with the Office of Research Affairs, as well as the EDI office. We also have external community partners. We've prioritized for this early phase of the school, Live Well San Diego, Imperial County Health Services, the Tijuana Estuary space, the San Diego State University, as well as our Naval Health Research Center activities. We've also tried to find ways for our community to connect with each other in order to serve the greater community. And I've seen many of you and had a chance to watch you derive such happiness from serving Mama's Kitchen and supporting the San Diego Blood Bank, as well as the VA San Diego. So we'll continue to put together our quarterly service activities so that we can all have a chance to build and grow and sustainable relationships with the community. I just want to talk a little bit here about our goal within the School of building a commons. And when I think about the commons, I think about a place where we create a safety net for the people of the school. So when you're in need, you have a place to go to get something. And also when you're blessed, you have a place to share. And I cannot talk about the interim associate and assistant deans of this school without talking about the commons, because the appointment of each of these individuals was something that, as I considered their appointment, I also thought about the fit with the mentality of creating a commons for the school. So I'd like to, at this point, acknowledge our associate deans for the school. Appointed on an interim basis is Kimberly Brower in the space of education and student affairs, Loki Natarajan in research affairs, Eric Heckler in community partnerships, Sonia Jane in our JEDI space, Dennis Trinidad for faculty affairs and mentoring, Todd Gilmer for academic affairs, and Randy Brooks serves as our associate dean for business affairs. And then they are supported by assistant deans in the space of education. We have Sarah McMenamin and Michael Pratt. And in the research affairs, Richard Garfien. In community partnerships, Linda Hill. In faculty affairs and mentoring, Susie Hong. And in academic affairs, Cinnamon Bloss. This team is 62% female, 31% BIPOC, and they represent all of the disciplines of public health. With regards to our commons, you might say, what is that? How does that actually function? Well, it actually has been coming alive. Some examples of ways that individuals have given to the commons is when they've generated research support or gifts, and they need to be thoughtful and mindful about how to spend those funds. They have earmarked funds that support core needs within our school, for example, administrative needs. Another example is someone saying, I have, X amount of savings from a discretionary perspective, and I'd like to earmark this funding to support the career of a staff member who might be financially unstable over the next few months. Just recently, last week, and thank you to the person who would like to remain anonymous in this space, someone gave to our commons the support for our admins who support our faculty, earmarked dollars specifically to support that need, and our pool of funds that help us support that need. And then I won't give names here, but our associate and assistant deans in many cases have said, any stipends that come in to their compensation for their service in these roles have been placed back into our general community fund. And so thank you to those of us in the school who understand and see how the commons is going to help us all move forward productively. I would also say that, when you believe in the vision of a place and the mission of a place, I think it's really easy to give to a place. And so I see you all across the school at every level doing this routinely. I think that's a sign of a very healthy environment. I want to address also within the space of culture, our wellness and our safety. And so, as we think about building a school for which equity, diversity, inclusion are top of mind and really runs through all that we do in the school, I just want to remind us of opportunities to be responsible employees, be great bystanders, really support the efforts that we're doing in this space. We have on the campus an office for the prevention of harassment and discrimination. I think every single person who comes to any work environment has the right to be in an environment that is free of harassment or discrimination. And so I wanted to just remind everyone of these services that are available at our institution. And if you see something, say something. If you are not quite sure what to do about it, you can always come to my office or to our associate and assistant deans for faculty affairs, or any of the folks who are in the assistant and associate dean role, to let us know what's going on so that we can find ways to keep our community well and safe. Now, with regards to future directions for the school, I just want to take a few minutes to say, we are so fortunate to have a school where people are really well engaged. We are being recognized in many ways for the things that we do. You heard me point out in the education space some of the awards that our students have been getting. Hot off the press is the 2022 Chancellor's Dissertation Medal, which will be awarded to one of our PhD students in biostatistics, Yuki Ki. And that is a wonderful recognition of the training efforts that are happening in the school. We also would like to keep each other informed around what's going on in the life of the school. And we've put together communications efforts. Our new communications director, Yadira Galinda, has been very helpful and critical in our being able to do this. You see the week ahead come through every week. We know that at least half of you are clicking into the week ahead as Yadira is able to see those statistics on the back end. We also have our quarterly staff meetings. We have monthly meetings of our academics and faculty, and we are trying to continue to find ways to keep our community engaged, whether it's with the Compassionate Action Circle or our monthly Grand Rounds. With regards to Grand Rounds, I want to say thank you to the Grand Rounds team. They have put together a really fantastic set of speakers, and we're looking forward to expanding who we get to have come and hear those wonderful talks, because now that we have a virtual component to it, we see the potential for how that can be used. I also want to say in this space of engagement, thank you to the staff who have stepped forward and let us get to know you a bit better in the week ahead. You'll see that section. I think it's really nice for me anyway to, over time, I've gotten to see a little bit more about Yadira Galindo and Rang Zagblocki and Sarah Andrade, Sarah Yoon, Seiko Hata, Heather Fagan, Carrie Goldschmidt, Stephen Talley, Becky Siegel, Kathleen Wilson, Kyle Choi, Vivian Silva, Calvin Navarro, Martha Anderson, Alyssa Sweeney. Thank you all for stepping up and allowing us to get to know you. Now I just want to talk a little bit about where we are headed. Well, a lot of that's going to be linked to our strategic plan. The strategic plan really offers us an opportunity to figure out where our competitive advantage is, right? There are over 200 schools and programs of public health in this country. And with regards to our key areas of education, research, thinking about our people and thinking about our climate and our culture, we are talking with each other constantly about how we want to monitor and evaluate these spaces, continue to keep our student-centered approach, really grow our academic offerings in the spirit of thinking about accreditation, as well as creating a strong and and consistent research infrastructure with what we've been able to pull forward from our history and develop these external partnerships. We also want to ensure that the people of the school have what they need to thrive. And this goes, all the way through everything that we do. We want our students to be well supported, our staff, our academics, and all of this in the spirit of having a just environment that we work in. Now, we, in our strategic planning process, when I talk about growth and growing pains, have had a chance to really think about the what of the school and the why of the school. And now we're in that space of thinking about how we organize ourselves as a school. And so at this point, everyone's seen the proposal for the school, which would have teaching concentrations, research affinity groups, and spaces within which we do community engagement. We have solicited feedback from the various stakeholders of the school here. And overall, we have a lot of excitement about what is being proposed. But I would be remiss if I didn't say that it has been not straightforward and without some pain points. And particularly with regards to our faculty who work and teach in biostatistics and who are at this point not yet fully comfortable with the proposal for the School of Public Health. We also showed in a summary slide what the rationale is for why it is that we're proposing the school and the things that are different within the areas of academic affairs and education and research, faculty affairs, community partnerships, evaluation, advancing our JEDI mission, and creating advisory units for the school. So you'll see this blue arrow on the screen because I want to draw your attention to what we're really trying to do here, which is put together a structure that hopefully delivers on the things that we value, as well as supports our ability to accomplish the mission of the school. So we want a structure that's going to promote consistency and equity in how we think about academic affairs and how it's executed. We want to support the various teaching efforts within the school in an intentional way. We want to make sure we have interdisciplinarity and intersectionality of the things we do in research and be able to do cross-collaborative projects easily. We want to support diverse and equitable mentorship. We want to have a structure that acknowledges public health as a core function of what we do and having our community engaged with us as central to that work. We're looking at being accredited. We're committed to our JEDI initiatives, and we also want to be walking in a transparent and collaborative way and have external oversight and support for what we do. So with that, I want to say thank you so much for the opportunity to talk with you about the state of the school. Overall, I think the school is healthy. It is, again, not without some growing pains, but I remain hopeful that we are very well positioned to become that 21st century school of public health that could have the people within it thrive and the impact of the work of the people within it be outstanding.